So, since I've showed you the patient parameters window, now I'll show you how to use the devices. So the device window has its own device options located on the menu. For the cardiac monitor, you can pause the device and you can unpause it. You can do this to take better looks at the tracings or at the vital signs. You can also change the amount of numerics or vital sign values on the left and tracings or waveforms on the right. So, for example, I will set 5 vital sign numbers. As you can see, they're being cut off. I can change the size of the window, but they're still cut off a little bit. So I can change the font size to small so that they all fit. Similarly, I can adjust the amount of waveforms, and if I want to change what the actual vital signs or waveforms are, I can do that by right-clicking on the waveforms themselves. So for example, we have a tracing for the EKG lead 3. I can change it by popping up the right-click menu for EKG, and I can select lead V1. So now we have lead V1. Similarly, I can change pulse oximetry to either central venous pressure, arterial blood pressure, pulmonary artery pressure, respiratory rate, or end tidal capnography. So, for example, I can set up a arterial blood pressure and end tidal capnography. And to reflect these things on the left, we can change, for example, I can set the end tidal capnography to match with the end tidal capnography waveform, and so on and so on.